Hi there, I'm Dr. Jory Basso, Assistant Dean and Associate Professor at Southern California University of Health Sciences. Let's talk about the sunshine prescription, why avoiding the sun may be harming us. When was the last time your doctor recommended a dose of sunshine? Probably never. Yet a growing body of science suggests that safe, moderate sunlight exposure may be just as essential to health as diet and exercise, and that our current sun-shunning public health message may be doing more harm than good. You may have seen this picture floating around social media showing how in the old days we actually thought that the sun could help us heal. Where did we go wrong many years later? Current public health messaging emphasizes sun avoidance, sunscreen, and sunglasses. Much of this guidance stems from Australia, where high skin cancer rates among individuals of Northern European descent led to aggressive sun avoidance campaigns. These recent settlers, largely of British, Irish, or Scottish ancestry, have lighter skin and less melanin that evolved in low sunlight northern latitudes to maximize vitamin D production. When exposed to intense equatorial sun, they burn more easily, increasing their cancer risk. In contrast, indigenous populations with darker skin adapted in that environment over thousands of years have higher natural protection from UV radiation thanks to higher melanin levels. These sun avoidance campaigns were well intentioned. They were never meant to be a global one-size-fits-all solution. Applying them universally has done more harm than good. This is particularly true for people with darker skin living in northern latitudes who are now at a higher risk of vitamin D deficiency due to both lower UV levels and persistent messaging to avoid the sun. Millions worldwide are vitamin D deficient, a problem worsened by indoor lifestyles and broad public health campaigns that discourage sun exposure. While supplementation can help, especially in winter or northern regions, research shows it's no substitute for natural sunlight. Specifically UVB rays, which trigger critical processes beyond just vitamin D production. Crucially, UVB exposure is only possible when the sun is high in the sky around midday, the very time most health agencies recommend avoiding. And depending on skin tone, different people need vastly different amounts of sun. On a sunny day in Southern California, someone with very fair skin may need just 10 minutes of unprotected exposure to generate adequate vitamin D, whereas a person with very dark skin may need up to 45 minutes or more. This is where the Fitzpatrick skin type scale is useful, categorizing skin types from type 1, very fair, to type 6, very dark. Sun guidelines should be adapted accordingly, not based on outdated Eurocentric models. We need to rethink the sun as medicine. For too long, public health guidelines have treated sunlight as a threat rather than a vital input to human biology. It's time for a more balanced, personalized approach, one that recognizes both the risks of overexposure and the many benefits of moderate, safe sun. Research has linked regular sun exposure to improved cognitive function and reduced dementia risk, better cardiovascular and metabolic health, and potentially a decrease in type 2 diabetes, stronger immune function and reduced inflammation, enhanced mood and mental health, improved sleep through circadian rhythm regulation, pain reduction and modulation. These sun benefits may provide healthy, safe, and free alternatives for prescription drugs targeting anxiety, depression, pain, and insomnia pills, just to name a few. Yet few physicians proactively recommend regular sun exposure despite wide-ranging benefits. A recent AI-assisted analysis estimated that insufficient sun exposure may have contributed to hundreds of millions of preventable deaths since 1950. While speculative, the suggestion is clear. Underexposure to sunlight could be a serious public health oversight, and the evidence is shifting. In 2024, a position paper from Australia, co-authored by 19 researchers and cancer organizations, finally acknowledged that sun exposure guidelines must consider both geography and skin color. Another 2024 study in the Journal of Investigative Dermatology titled Sunlight, Time for a Rethink, challenges the long-standing view that sunlight should be minimized at all costs. Even mainstream voices are shifting the narrative. Popular science podcasts like the Huberman Lab and clinicians like Dr. Roger Schwalt, founder of MedCram YouTube channel and medical doctor in pulmonary and critical care, have emphasized the broader benefits of full-spectrum sunlight, including red light, infrared, and near-infrared. Dr. Schwalt was among the early advocates for sunlight's potential role in preventing and mitigating respiratory infections like COVID-19 and has a fantastic video explaining the benefits of sunlight to human health other than vitamin D. This video is a summary of the fantastic paper by Zimmerman and Reiter called Melatonin, Light and the Optics of the Human Body. One super fascinating finding is that infrared radiation from the sun stimulates our mitochondria to release melatonin, acting as a powerful antioxidant to mop up free radicals and prevent cellular damage and aging. Modern genetic research is also reinforcing the case. One example is the POMC gene, which stands for pro-opiomelanocortin. POMC is activated by sunlight and regulates numerous biological functions from appetite to energy expenditure.
It's clear to see that POMC is the place to be.
POMC's underactivation could even be contributing to the global rise in obesity. Bottom line, we've lived under the sun for hundreds of thousands of years. Avoiding it entirely, based on just a few decades of overly cautious, one-size-fits-all advice makes little evolutionary or scientific sense. Public health messaging needs to reflect today's science, not yesterday's fears. Let's stop treating the sun like it's our enemy. It's time to update our guidelines, educate people on individualized exposure, and promote sunlight as the free, powerful, and natural health tool it is. Don't burn, but catch those rays in smart, safe ways. There it is. Woo.